Tonight we'll go over the discussion forum 5.1. We'll review that, exactly what is that problem statement, right? And then we'll go over the posts. And then we have an exercise about forming a problem statement, which is important because you have to do that for your project. Then do some background on FMEA, which is the failure mode and effects analysis, and then something on root cause analysis. We covered root cause analysis a couple weeks ago, but that was just the 5 whys, which is kind of a simple approach to it. There is an FMEA RCA exercise, root cause analysis exercise, but it's similar to some of the stuff we did last week, so we'll just kind of look at that. And then discuss assignment 5.1. So if you notice, you might have everything's open on Blackboard, right, for the weeks. So you can take a look because of scheduling issues. That's why we kind of did that. And another thing that I kind of wanted to draw your attention to is assignment 7.1. That's the final one, right? And so everything's kind of building into that. But what I've done is kind of included other types of continuous process improvements. So I added in the PDSA, PDCA approach. And I mean, that's kind of, it's part of all of them a lot of times. And then I did put in FMEA, right, as well. So, and then with those, you'll still have to suggest 3 improvement tools. And we went over qualitative and quantitative tools last week. So you can include those in any one of these primarily. So let's see. All right, so the problem statement, it's important to set up a problem statement for your area of concern so you know what you're including, what you're not, right? So it can be a little bit more difficult than you think, right? Because a lot of times people want to go right to what the symptom is, right? It's like, oh, well, we're not getting enough activity in the discussion boards. Well, that's a symptom of a problem. What's the real problem, right? So, so we need to know and set it up by looking at the appropriate problem statement. So problem statement is about an area of concern, a condition to be improved upon, a difficulty to be eliminated, or a troubling question that exists in theory or in practice that points to the need for meaningful understanding and deliberate investigation. Or problem statement should describe an undesirable gap, and I like this one because you're thinking about what is our current state and what is our desired state, and there's this gulf in the middle, right? So we're trying to jump from one point to another. So problem statement should include absolute or relative measures of the problem, quantify the gap, which should not include possible causes or solutions. And so that's another one, right? Not jumping to conclusions because it's a problem statement. We want to investigate what the problem is so that we can get to the root cause and then make changes accordingly. So this is a way about thinking about problem statement development in 6 steps, right? These are kind of how you would formulate it in your mind before you actually start writing a problem statement. You identify the problem to be solved, which we did, right? We went through that with the exercise a couple weeks ago with the MHA program. What is the problem? And identify where the problem exists. Is it a place or a service type? And who's impacted by it? Identify how the problem is observed and the frequency of that problem. So now we're going to talk about actually writing it. And it's written in 3 steps, right? It's written in 3 kind of statements with 4 steps. So statement 1 is description of the ideal scenario, right? I said we're talking about a current state, and we want to go to an ideal statement. So you describe the goals, desired state, or the values that your audience considers important and that are relevant to the problem. But, so this is a connector, right? So this connector connects statement 1 and statement 2. It's like, but, however, whatever, unfortunately, or in spite of, some kind of connection word that shows that there's a gap. Statement 2 is the reality of the situation. Describe a condition that prevents the goal, state, or value discussed in the statement, and one from being achieved or realized at the present time. And then the third statement is, using specific details, show how the situation in statement 2 contains little promise of improvement unless something is done. And then lastly, you just have a goal. State a goal you would expect to achieve if the problem is improved. So an example, this is a hospital, right? In order to provide excellent patient care at minimal cost, Middletown Hospital needs diagnostic procedures that are safe, efficient, and accurate. In addition, the procedures should not be overly painful for the patient. However, currently, Middletown Hospital's main diagnostic tools for spinal injury or conditions are CT scans, myelograms. The CT alone scan fails to make clear diagnoses 60% of the time. While the CT scan fails, doctors must then resort to a myelogram. And while the myelograms are accurate, this procedure is painful and sometimes dangerous for the patient. So they're doing a lot of duplication, right? Because one fails and they could try another one. So the consequence for the audience in statement 3 is if Middletown Hospital continues to do this, they will not only be wasting time and money, which jeopardizes their overall efficiency and earning potential, also cause undue suffering and could lead patients to choose another hospital with more advanced facilities. So our goal here is to reduce the percentage of patients who receive 2 diagnostic procedures for the same condition by 5% next year. So you see how we step through step 1. This would be great if we had this. This is kind of the goal we're striving for, but there's an issue here. And 3, if it's not corrected, then what's going to happen, or what are the consequences? And then when we do correct it, what is our goal, right? So with that in mind, we'll look at the discussion board post that I saw so far, and we'll just see if these elements are included in them. So I do have these elements here, right? Okay, get rid of this guy. So we're looking for those 3 statements, right? And let's look at Shanuti's. She's not here, of course, but let's go through it. For the most part, the MHA program consists of discussion posts, paper, and presentation each week. So her problem is lacking greater variability in learning assignments. Although this pattern of structure can be nice as it allows students to generally assume what to expect each week and may make it more convenient for facilitators to prepare for, it lacks variation. Variation is important as it can help students be more engaged, capitalize on their strengths, better target their individual learning needs. I do recognize that writing papers, formulating, and verbally presenting content are all important to develop the writing skills, concepts, and ideas. And although there has been some variation assignments, adding more variation can help expand these skills. Providing different types of alignment, such as multiple choice quizzes or tests, can also help students apply knowledge. And this can help students and facilitators determine and better measure if students are learning, et cetera, et cetera. And then the goal, so there's providing students with at least one different kind of learning assignment at least once every 3 weeks, one that is different from the 3 types most often used. So do we see these elements in this particular discussion board post? Let me move us. Here we go.
I think she touches on a lot of them. I think it's just not necessarily in that like specific order. She
Okay.
kind of jumps around with how she has
Yeah.
hers. She has it like structured a little differently.
Right. And I think it's a little much, right? So, but some of that is required by the discussion board post as well. All right, so James, do you want to, I have yours up here. Do you want to kind of walk through this
Yeah,
for us? Okay.
absolutely. So the problem statement, the first sentence would be there's a lack of guest speakers and different voices presenting class material, which does not allow for differing points of view of lifetime experiences to enhance learning. So I would say, as far as compared to your outline there, that kind of touches on the first and the third statement, but doesn't at all talk about the hindrances or the issues of why it does not, why it's why it is a problem or why it's a difficult solution to fix.
Okay.
And then I just so the goal would be to have a guest lecturer, someone with business expertise on a particular week's topic, speak with the class at least twice per 7-week class.
Okay.
Obviously, this wouldn't be able to be occurring during this class, being that we're already 5 weeks in, but could go into effect for future classes. So it would help us as well as other people that enroll in the program in the future. So the measures would be number of guest speakers before, after, if the students like it, if the facilitator thinks the lectures are beneficial, and then to determine if there's an improved quality of our education based on having these different experiences and different points of view on particular topics.
Okay. So, guys, do you have any recommendations for James in terms of the scenarios that we painted here?
Not really.
So what is this first one? You have a problem statement. There's a lack of guest speakers and different voices presenting class material, which does not allow for differing points of view or lifetime experiences to enhance learning. I would say that's the but. That's the statement 2.
Okay.
The statement 1 is your description of an ideal scenario, right? So, you want to put in like, in order to provide excellent patient care, I'm just rereading this, right? But this is what they're trying to live towards, right?
Okay.
So, I mean, you might just have to tease something out of that. So I do think you have that number 2 space in there. It's the current situation, right? And so you might have, number 3 should really be the consequences for the students, which you have in mind. You have that particular group in mind, of course. Not only be wasting time, but what is the thing that if it's not corrected, what would happen? So that's what we kind of want to focus on. So in this particular one, we say statement 3 is using specific details show how the situation in statement 2 contains little promise of improvement unless something is done, right? That might be a little bit hard to kind of quantify. You don't necessarily have to do that, but you could just say something like, learning experiences can be enhanced by, and I think you kind of mentioned that, right?
Okay.
By getting different perspectives. And then you did a good job in stating the goal, and you even put metrics in the goal, right? Which is good. Okay, I've lost my way here. Okay, so this is Justin's as well. Goal to double the number. Problem statement, MHA currently has a limited number. He did kind of the same thing, right? This is the problem. Instead of saying this is a scenario where we want to aim for, and then coming back at that. So why don't we, to kind of help each other, why don't we just go spend 10 minutes? I'll put up the kind of scenarios and just write something based on one of those. James, you can use the same one, right? Based on something that you pick out as one particular area, improvement area. Do you guys, Chris and Amber, do you remember the improvement areas?
I haven't submitted mine, but I have what I was gonna do. I was just gonna do it on. It's kind of still like variation in
Okay.
assignments. I was specifically talking about group work, though. Is that all right?
Sure, that's fine. So yeah, we'll spend 10 more minutes and then we'll just kind of regroup and go through them. So, and actually for your post, for your second post, you can just include that, like James, when you already did, just revise it and post it. That can be your, because I know you responded to someone too, so this is kind of working on this
Okay.
through. How's it going?
I think I have one that's less bad than the first one.
Okay, you want to hit it?
Okay. So in the ideal learning environment, many different voices and points of view are used and beneficial to enhance individuals and group educational experiences. However, there is a lack of guest speakers and different voices presenting class material currently in the MHA program, which does not allow for differing points of view or lifetime experiences to enhance learning. If the MHA program does not start to include guest speakers and different voices on topics of education, then a disservice is being done to the educational process of each student enrolled in the program. Goal would be to have a guest lecturer or someone with business expertise on a particular week's topic speak with the class at least 2 times per 7-week class.
Boom, that's great. Yeah, I especially like that statement 1. It sets everything up, right?
Right.
Yeah, so that's really cool. The nice stuff.
That one was a little better than the first one, I think.
Well, you're given some parameters, right? So it's why we try to use these tools, right? Someone has already done it for us, and they tend to work. So,
Yeah.
okay, Amber, ready?
Yes. So my problem statement is, in order for Gannett to provide the most well-rounded MHA program education, students must be given the opportunity to interact with one another and share their unique knowledge and skill sets with one another, not only to gain knowledge, but also to encourage networking with other healthcare professionals. Currently, the MHA program assignments have all been independent outside of weekly discussion posts. While this form of group work does allow for some level of conversation, it is not enough to learn from one another. For this to happen, the responses would need to be more of an open conversation versus critiques. Without implementing additional opportunities to work with one another on projects and papers, graduating students may lack the shared knowledge they could have otherwise had. Along with this, they may not be comfortable networking and having discussions with others in the healthcare field they enter into. The goal would be to implement 1 to 2 group assignments per class in hopes of increasing knowledge, background, and networking communication skills.
Good. Okay, great. Same thing. I think you set it up pretty well. So that gives you a lot of opportunity to kind of deal with those other statements, right? Good. And did Chris drop off, I guess?
I was going to say, I don't know where he went. Let me see if he messaged me, because normally if he disappears, oh, his power went out and he has no internet connection. I was going to say, normally he'll text me if something happens.
That's great. Yeah, I had that happen to me last week at another class, and I had to do I just had to use my phone for it. So, but okay, so we went through that. So that's great. And then this is not only for the discussion board posts, but also for your project, right? When you're thinking about the continuous process improvement project, you'd set up the problem statement, and then basically everything kind of flows from that, right? Okay, so let's talk a little bit about the failure modes and effects analysis. And this is, they use this quite a bit. There's, several pages, I suppose, in the textbook about FMEA. The nice thing about FMEA is that it's proactive, right? So it's a proactive risk assessment that involves close examination of a process to determine what improvements are needed. And it's healthcare specific too, so, or was developed by that. It's developed in manufacturing and aviation, but then moved to other industries. Now, healthcare organizations use the technique to evaluate and improve the safety of patient care. And since 2002, hospitals and skilled nursing facilities accredited by the Joint Commission have been required to periodically conduct proactive risk assessments for patient safety improvement purposes. And so that's why I kind of included this as a continuous process improvement model that you can use, because it's used a lot in healthcare, right? And the Joint Commission obviously is looking for that. So FMEA is one of the most widely used tools through the Institute of Healthcare improvement. And in this particular link, it just guides you through the tool primarily. It shouldn't be a video. It's just, it's really the toolbox that hospitals can use or healthcare facilities can use to talk about this. So there is one video. He's by 3 minutes, 2 minutes. So I'll go, wait. Hold on there, buddy. So this isn't actually doing what I wanted to do. So there's always a button here that says, you couldn't hear that video, right?
Mm-mm.
No.
There's always a button here that says live audio, and for some reason, it's not here tonight, which is problematic. But anyway, the failure modes and effects analysis toolbox is here, right? So basically, it's in this particular scenario, it's provided by the Institute for Healthcare Improvement. And so the steps in the process they go through, and then here's kind of the document that they have that I'll show you. But basically, someone who's a member could pull that up and also look at that. So the nice thing about it is promote systematic thinking about what could go wrong, because you're doing it without having, something actually happen, right? Because that would be what we're looking for next. Okay, things are just going awry here. Because it's proactive. So promotes that systematic thinking of quality improvement, what needs to be done to prevent a bad result when something does go wrong. And so you're going to plan for that. It's like, well, we have to think about all the scenarios that might happen, and if that happens, what are the effects of it? That's why it's called modes and effects, right? So organizations engage in root cause analysis or failure modes and effect analysis to examine the medical errors and determine the process needed to remove those. And it's a systematic, proactive approach, right? And there's the tool that I just talked about. So this should be familiar, right? This is the PDSA kind of process. And FMEA kind of uses this, and that's kind of why it's kind of also included as one of those continuous process improvement projects or models. But basically, it really fits in this number 2 of plan, right? Because you're conducting a hazard analysis, and that's what makes FMEA specific. The rest of it tends to be the same as any other PDSA kind of approach. So when we're planning, that's where this fits in. You organize information about the process. As always, you develop a high-level flow chart to visualize each step. And then you brainstorm a list, right? So not everyone's going to think of the same thing. So you need a lot of people to think about what are some of the events that could happen, right? And then after identifying each failure, you determine the risk or criticality of each to prioritize it for elimination. And then you use what's called frequency, severity, and detection scores, and I'll show you the template. So the frequency is really the probability that failure will occur. The severity is the degree of harm that it could cause to patients or staff if failures occur. And then detection, what's the likelihood the failure will be detected before harm occurs? And then with the math that's behind it, you prioritize the highest critical issues and determine what would cause what would cause those critical issues. So basically, here's the FMEA toolkit from the Institute for Healthcare Improvement, and it's on Blackboard just like this, and also in the course resources. So basically, you're developing, what are the steps in the process? Those are your failure modes. What could be the causes, and what are the effects? And then what's the likelihood of occurrence, and then likelihood of detection, severity, risk profile number, etc. So the questions you ask of yourself is who might experience the problem? Is it limited to one person or everyone? Obviously, the ones that are more limit or not as limited, then they're going to have a higher severity level on a 1 to 10 scale. And what is the specific problem? You have to ask yourself, where might it occur? Where is the failure unlikely to happen? And when would probably be it likely to be happening? When would the problem not likely to happen, and why might the failure occur, and why doesn't it occur all the time? How many times has it occurred that you know of, and can the process be changed to eliminate reduce the chance that it will occur again? So we have one example here, right? And we have process steps that are going on and some failure modes, right? So we have something going on with the tests that are ordered and then completed are not matching, right? And so what are some of the things that could have happened with that? Well, those are the failure modes, right? Well, the wrong test could have been ordered by the physician, okay? And that then led to the wrong patient perhaps being tested. If that was, there could be a wrong test on the right patient, right? Or the right test on the wrong patient, which be wrong, I guess. So it could lead to the wrong patient being tested. Or another failure mode is a patient not properly prepared for the test, which would mean that would be inadequate specimen collected. So a lot of times, if patients haven't fasted or something like that, and that was part of the issue that they needed to do, for prep, then then they couldn't collect it. They couldn't run the test, right? So that's another failure mode. Or a third failure mode could be incomplete order for a test, and that could be the wrong test performed on the right patient. So basically, when you look at this in the course resources, if you're going to do the FMEA, you could just basically put this in as an example, right? Because you're trying to convince people in your argument that this is the right approach. And so you would you could list out a couple of failures if you know what those possibly could be. Come on.
What exactly would go in the failure mode column?
Just those things. So like what was the issue, right? What are all the issues that could have happened, right? Okay, so the wrong test, or as I I'm all stuck here, right? But my PowerPoint is crapping out on me. So let me try on Blackboard here, course resources. I put it in other. Okay, so we can do this together, right? Seriously? Okay. Wow, that's really not helpful. Okay, this is my third attempt. We could do an FMEA on this. So to answer your question, okay, that's fine. If we were going to do something, let's do this, right? So I have it up now. I'll probably get 3 of them, but okay, so there are steps in the process. It could be steps in the process, but if we were to use like the MHA program, right? we could say improving MHA. Well, if we go back to, let's see. Yes, and so if we go to this, right? So we say, okay, we can create these as the first Blackboard and technical issues. Well, that's appropriate. So we say, okay, this will be Blackboard and technical issues. And then our failure modes could be what everyone mentioned, right? Because, you know, you're just primarily coming in and saying, all right, so we don't have other weeks available. And then we could list out what are the causes, right? So, well, the cause of that is primarily that's the standard approach for the university, right? What are the effects of that? Like, why is that an important thing to be able to view that?
It allows you to plan ahead.
Okay. And I don't know why they do that, just they do. Okay, so, and some of it is basically because they don't want people to jump ahead without kind of having a knowledge of what preceded that. So a lot of times people try to bulk up on stuff, and they'll say, "Oh, I'm going to do a lot of weeks," but like with the discussion board stuff, you know, like we did tonight, you know, if I wanted to look at that 3-statement pattern, you would have gone ahead and done that, and then put it into assignment 7 the way, you know. So that's kind of one of the reasons. So if we wanted to look at this, what's the likelihood of this occurring? Well, we already know, right, that our likelihood is pretty high, although I did change it, right? What's the likelihood of detection? Well, it's really high because you guys have detected it. What's the severity? So that's that's an important one. How much does it impinge upon your kind of?
It's a convenience factor, so probably 1 or 2.
Okay, that's fair. So I already did this, so it's 180, right? So if we did another one, and we still looked at, maybe we look at a different one. We could do other Blackboard ones, but just to get a kind of an idea about how they would differ. How about outside speakers, right? Because Amber, you mentioned that one. Or
And I'm so sorry, but I have
that's
to
okay.
go. I feel
Okay,
so bad. I don't mean to leave you guys.
no worries.
Okay, I'll see you guys next week.
Okay, see ya.
Have a good one.
Thanks.
So if we had outside speakers, well, let's see. Failure mode is what did you say, James? That was one of yours, wasn't it? Not
Would it
enough.
be not having
Yeah,
enough different points of view?
yeah, diversity of view, right? The failure causes, there could be a lot, right? It's identifying appropriate people, scheduling. We did mention some of these in like when we said the 5 whys. And so that's, important thing what we pull in, so that kind of builds upon that. And so, and you mentioned really well in your problem statement, the failure effects is you don't get the richness of, right, an education experience, right? So likelihood of occurrence, I mean, it occurs now, right? Let's see. But it can be corrected. So, but maybe It's not as likely to occur as 9 because that's kind of a university policy,
Right.
the Blackboard Tech issue. So I might put it like at a, I don't know, a 7 or something like that. It just takes time and effort. Likelihood of detection, well, you'd be able to detect that pretty well, right? So that's a 10. And what's the severity?
Maybe a 4.
Yeah, probably a little higher than the other one, right? So, I mean, basically, then you're trying to see what the scores are across
Mhm.
those. And if you have a bunch of them, then you know what the risk profile number is, right? And that's just telling you that, this is the one you need to concentrate on first, then you have another one that you need to concentrate on, et cetera, and et cetera, right? So, I mean, it's a good tool just to kind of frame um, your priorities. Let's go back here. And then, of course, from that, you just do the PDSA as you would.
And then, I mean, it stands to reason that you would obviously choose the one with the, at least this is what it looked like on the example you gave, is you choose the one that has the highest number and then do a PDSA cycle with that problem.
Right.
Okay.
Yes. Because it's really important with any of these continuous process improvement things that you're not changing. It's just like an experiment. You don't
Right.
want to change too many things at one time because then you don't know what's made the overall effect,
Mhm.
right? So, and that's critical in some of these as well. So, we did that. Okay. So the other steps are the same as those in any improvement project. Now, I've seen improvement projects and continuous process improvement that had multiple layers at one kind of different time. It's just that can you isolate? You want to make sure you can isolate the measurements.
Mhm.
So that if they can be easily isolated and measured, then you can do a couple at a time. And of course, sometimes based on staff too. Okay, so the other thing is a root cause analysis, and root cause analysis a little bit different. It's been used in other industries as well. The Joint Commission has required to conduct an RCA after what they call sentinel events, right? So something happened in a healthcare facility, and those are incidents generally with death or serious harm to a patient. And it really kind of started when NASA did it with the Challenger disaster. They used root cause analysis to come up with the cause of that accident. So Joint Commission again encourages those organizations to conduct RCA following a near miss, which doesn't mean that there was any patient harm, but there could have been patient harm. Right? And so they kind of follow the same pattern. It's aligned with the PDSA. You understand what happened, identify the root causes, number 2, right? And so it comes in there. Develop risk reduction strategies to prevent that reoccurrence. And it's really kind of important to do that. You're planning up front because you don't want anything else to happen. And then you implement pilot test the process changes and then evaluate whether those have achieved the desired result, and then make the process changes permanent, right? So you do that like you take a pilot like one site or one department and you kind of make this change and then see how that affects the outcome. And then if it works, then you roll it out to a larger group. Again, understand what happened. It always starts forming an RCA team, and then the team gathers the data through interviews or quantitative data from data mining or internal external sources. And so basically, this is kind of trying to get the information and the data to kind of identify what happened and then create a high-level flow chart of the event that occurred, right? And then you use the 5 whys or fishbone or Pareto chart to try to kind of synthesize that a little bit more. Then you develop solutions or corrective actions, look at what should be eliminated or controlled, and then overall just a Gantt chart or planning matrix to kind of work through that particular plan. Of course, we went through high-level flow charts, but this would just, this is an example of one of customer giving a prescription to a pharmacy clerk, logged into the pharmacy computer by clerk, prescription passed to pharmacist, filled by pharmacist, medication container label. So it has nothing underneath it. It's just kind of a regular process that's high level. It's not kind of going into a lot of details, not a detailed process chart. And then, of course, there is that 5 whys, which helps us in RCA to identify. We went through that, and there's also a link to this exact template on Blackboard. We did a cause and effect diagram, identifies all the possible causes of an effect, and then creates that effect diagram to be identified. And we talked about using it in 2 ways. The methods, you identify all the methods: manpower, materials, or machinery, the 4 M's, or the 4 P's, the policies, procedures, people, and plant. And then the team identifies all the particular categories and the significant causes through brainstorming, like a lot of these other things. And then position on the diagram, the team digs deeper to identify the sub-factors. So we talked about this one. The effect is really the long clinic wait times, but we're using environment, procedures, equipment, and people here. And I just primarily did that because that's what the textbook uses, although you can fit in that as 4 M's or 4 P's as well. And so, you're having what the environment is: not enough exam rooms, exam supply cabinet not handy, medication cabinet is locked. And even on these, then you would dig deeper into them to find out why. Why are there not enough exam rooms, right? We'd planned for a certain volume, and that volume is increased for whatever reason. So you dig into what those particular things are, and then perform the PDSA after that.
Could you use each of those problems, so each of the little dashes there on the fishbone, in the failure mode and effects analysis? Like, could that go under the category of the failure mode?
You could. So you could say, this is my failure, right? This is the effect. Right. And then you would put in, that's almost like, why couldn't you, right? So we could say, so this is the MHA program improvement areas, right? And then we identified these, and then you guys came up with these, right? And then we could dig further into it. So you could use that. Yeah.
You could use a fishbone diagram really for either of them. It kind of just points out everything that could be the problem, or is contributing to the problem.
Right. Okay. Yeah. And these could be more extensive too, but and then the idea is just to kind of dive into them from there. And then, of course, that's the planning of the Gantt chart. So the RCA steps I've mentioned is aligned with PDSA. Other steps are the same as any other improvement project. And that's what's nice with that PDSA or PDCA approach, is that it's like used frequently across all kinds of improvement projects. So we did that, and this is just a 5-1. Assignment 5-1 is just compare and apply either the FMEA or root cause analysis to the healthcare quality issue you was identified in assignment 4-1. And then you're just going to say, why would that kind of approach be appropriate? So, for root cause analysis, you're going to do that same kind of approach, right? So it's going to be, aligning this. But obviously, one thing that's going to differentiate whether you decide it's FMEA or root cause analysis is if you've done it, or the organization is going to do it on its own. That would be an FMEA, right? If they just do it proactively by seeing data or something like that, where an RCA is really based on a sentinel event.
Okay.
So yours is more going to be appropriate for the FMEA, right?
Right.
Because a sentinel event could be, probably infant mortality, right? Because, they're not brought to term. But I don't know that that's an issue, right?
Right.
So I would imagine yours would be FMEA. And then you could basically, if you wanted just to use FMEA for your final project, then you could do that, right? So this kind of builds into that.
And for the root cause analysis, once you do the fishbone or whatever tool you want to use, how do you determine which is the, most important factor to do the PDSA cycle on? Because, with the FMEA, you at least have a numerical value.
Right.
Hey, I think this one's probably the most important one.
Yeah, well, my familiarity with these are that basically we're going to be doing like a multi-voting procedure.
Okay.
Like we did that one night.
Yes.
And like I'm used to getting into a big a big room with 20, 25 other people, and they're just kind of putting up, and they're just usually cross-functional type of
Okay.
group. So then basically you vote on which ones you think are going to be most appropriate.
Okay.
I mean, you could do a survey too to people who are affected, to some of the stakeholders and things like that. I do kind of like the more quantitative approach.
Mhm.
I mean, those still, when you build in those quantitative approach, you're still thinking qualitatively. It's like, oh, I think it's kind of like this, but I mean, at least you have something to kind of guide you a little bit
Right.
better.
It's still subjective. It's just
Yeah,
your subjection as to a group subjection.
right. Yeah, right. And I mean, you could use that in a group setting too.
Hmm.
The FMEA. I mean, you could just do an average.
Kind of like what we did in the last
Right.
session.
Yeah, exactly.
Okay.
So, okay, anything else?
I don't think so.
Okay. Well, if you have any questions, let me know.
Awesome. Thanks a
Okay,
lot.
cool.
Have a good week.
Yeah, you too. Thanks, James. See
All
ya.
right. Bye.